The Achilles InSight is a compact, easy-to-use bone ultrasonometer for the assessment of osteoporosis fracture risk, aid to diagnosis, and for monitoring bone changes due to disease or the response to therapy. The Achilles InSight uses the latest, highly integrated digital technology. It sets a new standard for performance by eliminating the problem of blind measurements. Prior to the measurement, a two-dimensional receiving array with sophisticated signal processing instantaneously displays a near real-time image showing where the ultrasound beam will pass through the heel. It is fully backed by the award-winning customer support of GE Lunar, the world leader in bone diagnostic technology. This video guide describes setup, daily operation, and maintenance of the Achilles InSight. During this program, a section number will be displayed in the lower right-hand corner of the screen. This number can be cross-referenced with the included video script for language translation and easy review. Important: for detailed information, you must read the supplied InSight Operator's Manual and Quick Reference Guide. Inside the shipping carton, you will find the First Use and Quick Reference Guides. The First Use Guide details the procedures necessary to prepare the InSight for first-time operation. The Quick Reference Guide outlines basic operating procedures. Your system carton contains a country-specific destination kit, which includes standard items for operating the InSight, and a patient measurement kit, which includes all the consumable items necessary for 200 measurements. Be sure to inspect the InSight for damage after removing the InSight from the shipping carton. Your system may also include purchased options. Please follow the instructions provided with each accessory. Stored inside the InSight are the Quality Assurance Test Cylinder and Membrane Guide. Lift the calf support, remove the foot plate, and retrieve these items before proceeding with setup and first use. Important: contact GE Lunar to report any damaged or missing items. Before first use, the InSight's shipping membranes must be replaced with a new pair, and the InSight must be filled with AquaDry solution. You will find the membranes in the 200 measurement kit. Other necessary items are in the destination kit. To begin, connect the power cord to the rear connector, and if necessary, install a medical-approved power plug adapter to match your country's electrical connection. Use the switch at the rear of the unit to turn power on. The LCD will display an image, and at the bottom of the screen, the startup status is shown. Since this is the first time the InSight is being operated, a display indicating the need to fill the InSight with AquaDry solution will appear. Touch Continue, then Maintenance, then Add Water Procedure. Follow the on-screen prompts, and then press Continue. To begin the AquaDry filling procedure, remove the calf support. Slide the support underneath the handle end to raise the InSight to the height needed for adding the AquaDry solution. Use a coin to remove the fill cap. Turn the membrane retaining rings counterclockwise to loosen and remove. Then lift off the shipping membranes. Before installing new membranes, add 1 bottle of AquaDry solution. Confirm that the system is completely filled by viewing the fluid level in the fill port. Replace the fill plug. Install the new membranes. Be sure the outside lip of the membrane is fully seated into the holding slot. Reinstall the retaining ring by turning it clockwise to hold the membrane securely in place. From the LCD display, touch Continue. The membranes will fill with solution. Inspect the membranes for leaks. If necessary, remove the rings to either reseat or replace the leaking membrane. After inspecting the membranes, press Drain to continue. After the membranes drain, remove the fill plug and, if necessary, add AquaDry solution from the second bottle until the InSight is completely filled. Replace the fill plug and run the Add Water procedure again. Verify that the membranes are at least 95% filled. Important: if the membranes are not at least 95% filled, repeat the Add Water procedure. After completing the Add Water procedure, reattach the calf support and reinstall the footplate. Important: when installing the footplate, be sure to line up the footplate tabs with the mounting slots. The InSight is ready for patient measurement after passing a quality assurance test. Important: before continuing, stop this videotape and complete the Add Water and membrane replacement procedures. Review the quick reference guide and the operator manual, which includes detailed information on the indications for use, instrument operation, the basics of ultrasound measurement, and important clinical references. Now that you have unpacked the InSight, replaced the shipping membranes with a new pair, filled the InSight with AquaDry solution, and reviewed the quick reference guide and the operator manual, the InSight must now pass a quality assurance test before a patient measurement can be taken. Important: the software will prompt you to complete the quality assurance test every 7 days. When the InSight power is turned on, the LCD display will show an image and startup status. The InSight will then automatically begin to warm the AquaDry reservoir solution to operating temperature. The LCD display, heating degrees, will disappear when the system is ready for use. Important: you must wait until the solution reservoir is at the correct temperature before using the InSight. Important: before continuing, from the LCD display menu, touch System Maintenance. Then Configure. Verify the time and date, reference and printing features are configured appropriately. Refer to the operator manual for detailed instruction on changing these values. Now press Backup to return to the main menu. Press Quality Assurance to begin the test procedure. You'll be prompted to apply ultrasound gel to the membranes and quality assurance test cylinder. Important: for proper coupling, the entire surface of the membranes and the inside flanges of the test cylinder must be completely covered with a moderate layer of ultrasound gel. After applying the gel, place the test cylinder between the membranes. Press Continue. The membranes will automatically fill with solution. The membranes must be at least 95% filled, or you should perform the Add Water procedure. If the membranes are sufficiently filled, press Continue. The quality assurance test will continue for several minutes. When the quality assurance test is completed, the LCD should display Quality Assurance Passed. If the system does not pass, repeat the test. Important: if the quality assurance test fails a second time, repeat the Add Water procedure. Reapply gel to the test cylinder and membranes, and repeat the quality assurance test. If the InSight fails the test again, print out the test results and contact the Lunar Customer Support Department or your local GE Lunar distributor. With the successful completion of a quality assurance test, the InSight is ready for patient measurement. Clean the membranes and install the membrane guide. The most important factors in making reliable, repeatable measurements are foot selection, chair selection and positioning, heel preparation, leg and heel alignment. When selecting the foot to measure, certain criteria must be met. No current or prior injuries to the measured heel, ankle, or leg. No breached skin or open sores on the foot or heel area. And normally, you would select the right foot for taking a measurement. Remember, the patient's T-score is based on comparison of the patient's most normal foot with those expected from normal young adult values. Chair selection and positioning is important. Select a chair that is stable, has armrests, and that does not have wheels. Position the chair directly in front of the InSight, either to the left or right depending on the foot to be measured. For shortest measurement time, gel must be properly applied to the skin. Ultrasound gel requires both sides and the rear of the heel to be completely covered. If the heel is dry or calloused, apply gel. Wait a minute for the gel to soak in, then reapply an additional layer. Both membrane surfaces must also be completely covered by gel. For proper leg alignment, position the leg so the foot, calf, and thigh are aligned with the center of the foot plate and calf support. Correct heel positioning requires that the foot is lying flat against the foot plate, that the toe peg is positioned between the first two toes and is secured, that the heel is pushed fully back, that the calf is lightly resting against the fully extended calf support, that the ankle strap is tightly attached to avoid movement, and be sure that the membrane guide is in place. Important: the calf support should be fully extended. The patient's leg should rest lightly against the calf support. If the calf rests too heavily on the support, the heel will be too far forward. Always tightly attach the ankle strap to avoid foot movement during measurement. Improper positioning may result in error messages being displayed during measurement. Correct positioning is mandatory for valid repeatable measurements. Before we begin patient measurement, let us summarize what has been discussed. We have performed a quality assurance test, and the Achilles InSight has passed. We have discussed the criteria for selecting the appropriate foot to measure and to normally use the right foot. We have demonstrated how to position the chair and patient so that the hip and calf are properly aligned with the InSight. We have illustrated the proper method to apply gel to the heel and membranes. And we have discussed and illustrated the importance of correctly positioning the leg and heel and to always use the ankle strap. Before the patient arrives, prepare the InSight for the measurement. Raise the calf support to its fully extended position and install the membrane guide and ankle strap. Select a straight back chair that has no wheels and position the chair to align the patient's hip with the InSight. When the patient arrives, determine if the right foot meets the foot selection criteria. If not, you may have to measure the left foot instead. Seat the patient and have the patient remove her footwear. Touch Patient Measurement on the main menu screen. Use the pre-assigned ID number, or enter a unique medical number up to 15 characters in length. Enter the patient's age. The InSight is preset to sex female and foot right. To change either of the values, touch the screen. Now press Start and follow the on-screen prompts. Apply ultrasound gel to the sides and back of the heel. And to the total contact area of the membranes. Place the foot on the foot plate. Verify that the heel is fully back against the heel rest. Adjust and tighten the toe peg between the first and second toes. Tighten the ankle strap. Verify the patient leg is straight from the foot to the hip. and that the calf is lightly resting against the calf support. Touch Continue, and the membranes will begin to fill. A preview image of the heel will be displayed. The anatomical orientation is shown on the LCD. The red circle indicates the region of measurement and shows the approximate location where the ultrasound beam will pass through the heel. Note, the image is not to be used for diagnosis. The buttons to the left of the image allows adjustment of the best visualization of both the bone and soft tissue. The image setting is shown as a numerical value. Adjust the image for best clarity. When the heel is centered within the circle, touch Continue. The display will change from the image to the measurement screen. The screen will show the progress, action, and status of the measurement. At the top of the screen, you will see the measurement signal waveform. The waveform should be well-defined, symmetrical, and have 2 peaks. Measurement times may vary, but generally are about 1 minute in length. Correct patient positioning and sufficient application of ultrasound gel will minimize the total time. Important: make sure that the patient does not move during the measurement. Movement affects the stability of the ultrasound signal and lengthens the measurement time. If the InSight detects a problem during measurement, the measurement time may be extended. The screen may display: signal too small, apply more coupling gel, measurement error, or unable to converge, repeat patient preparation. If one of these messages appears, you will need to apply more ultrasound gel and repeat the measurement procedure. A signal too low message may indicate a valid condition. In a small number of patients, the heel may be extremely dense with low likelihood of osteoporosis. The InSight measures patient stiffness index values as great as +2T, referenced to the young adult value. When the measurement is complete, the system will automatically drain the membranes and display the measurement results. If auto print was enabled in system configuration, the InSight's thermal printer automatically prints the measurement results. If not, touch Print to manually print the test results. After the measurement, the LCD displays either the measurement results or the measurement image. Measurement results are stored in the InSight's internal memory. Only the current image or the last 100 measurements can be recalled to find a prior patient result or to correct errors in ID number, age, or gender. The recalled results can be displayed and printed. Important: consult the operator manual for information concerning interpretation of the test results and for information on monitoring bone changes. The results screen shows values for stiffness index, T-score, and Z-score. The T-score compares the measured value to the mean value expected for young adults of age 20 to 35 years. The InSight is approved by the FDA to assist in the diagnosis of osteoporosis. The report graph shows the patient's World Health Organization classification. Above -1T, normal. Between -1T and -2.5T, low bone quality. And less than -2.5T, osteoporosis. The percentage of young adult value is also reported. The Z-score compares the patient's stiffness value to a curve of expected values for patients of the same age. The Z-score can be used to assess the relative fracture risk compared to patients of the same age. The Z-score result also indicates the percent age-matched value. The Achilles InSight is approved by the FDA for indication of relative risk of osteoporosis fracture in postmenopausal women. The right side of the measurement results screen provides a curve for analyzing relative fracture risk. Note that the fracture risk increases dramatically with low values. Please consult the InSight Operator Manual for additional clinical information. The region of measurement image can be selected for display. It also includes the patient information. Note: the image is not to be used for diagnosis. The Achilles InSight is also FDA approved for monitoring bone changes, a critical benefit to confirm response to therapy and to encourage compliance. Stiffness index measurements, taken at intervals of 12 to 24 months, allow following change in bone quality. Consult the appendix of the operator manual for detailed information. For monitoring, the InSight provides a repeat measurement mode, which improves follow-up confidence by providing a single stiffness result from several repeat measurements. Repeat measurement is the same as standard measurement, except that the menu will prompt you to remove and reinsert the patient's foot to make multiple measurements. When complete, the repeat measurement stiffness value is displayed. Important: after making a baseline repeat measurement, use appropriately scheduled follow-up measurements to assess the changes due to aging or therapy. To facilitate your understanding, the patient measurement procedure will be repeated in summary form. Prepare for the patient's arrival by having the InSight ready for operation, correctly positioning the chair, and fully extending the calf support. When the patient arrives, select the appropriate foot for measurement. Seat the patient and have the patient remove her footwear. Enter the patient's information and touch Start to continue. Apply ultrasound gel to the total heel area and to both InSight membranes. Align the leg and position the heel. Secure the toe peg and fasten the ankle strap. Press Continue. Align the heel in the region of measurement circle using visual feedback from the InSight's LCD. Begin the measurement. Be sure the patient does not move. After the measurement is complete, view and assess the displayed values, the measurement image, and print out the test results. Important for patient measurement, the following criteria must be met. The InSight must successfully pass the quality assurance test every 7 days. A sufficient amount of ultrasound gel must be applied to the patient's entire heel area and the total surface of both InSight membranes. The membrane guide is installed. When seated, the patient's foot, calf, and thigh are aligned with the center of the InSight's fully extended calf support and footplate. The patient's calf must be resting gently against the InSight's calf support. The patient's heel must be fully back against the InSight's footplate heel support. The InSight's toe guide must be secured between the first 2 toes. The InSight's ankle strap must be tightly secured around the patient's ankle. Before beginning a measurement, confirm that the InSight's red region of measurement circle is within the cortical shell. After each use, the InSight must be properly cleaned. Warning: You must perform a low-level disinfection after each patient measurement. Caution: some ultrasound disinfectants may damage plastic materials. Use a 70% minimum alcohol solution or a Lunar-approved cleaning solution. Clean the footplate, toe peg, membrane guide, membranes, and other patient contact areas. To prevent damage and maximize membrane life, use a soft cleaning tissue. Avoid dry or rough cleaning materials. Allow all surfaces to dry and repeat the cleaning a second time. Warning: be careful not to puncture the membranes with sharp objects or fingernails. Operator help provides the instructions for replacing membranes. To change the membranes, follow the LCD screen instructions. Inspect the membranes after each measurement for water leaks. Important: membranes should be replaced in pairs. Remove the knurled membrane retaining ring. Slip off the defective membrane and dry the transducer tower. Replace with a new membrane. Be sure to firmly tighten the membrane retaining ring. From the System Maintenance menu, select Fill to inflate the membrane and inspect for leaks. Membranes should be at least 95% filled. If necessary, use the Add Water procedure to eliminate excess air and properly fill the membranes. Remember to use Lunar Aqua Dry Filling Solution. After inspecting the membranes, press Drain to return to normal operation. Approximately every 100 measurements, the thermal printer paper will need to be replaced. To change the printer paper, swing open the printer door. Raise the feed lever and remove the old spool. Position the roll so that the paper feeds from the bottom. Insert the paper between the rollers. Manually feed 2 to 3 inches of paper through the rollers. Lower the feed lever. Roll up any excess paper and push the roll into position. Pass the paper through the exit slot and close the printer door. In summary, be sure to read both the Quick Reference Guide and Operator Manual before using the InSight. Complete the quality assurance test before first use and every 7 days thereafter. Follow the procedures for patient alignment, foot selection, ultrasound gel application, and heel alignment before taking a patient measurement. Properly clean and disinfect the Achilles InSight after every use. Note: the image displayed during the measurement procedure is not to be used for diagnosis. If your system includes the optional measurement summary and analysis software, the last 100 measurement results can be transferred from the InSight memory to an external PC running Excel spreadsheet for further study and trending analysis. An optional bag and cart is available to aid in the protection and transport of the Achilles InSight. The bag includes pockets for accessories. For airline or freight shipping, you may order a hard-sided case with wheels. This video has provided an overview of the setup, basic operation, and maintenance of the Lunar Achilles InSight. In the USA, Your InSight Marketing Binder contains information to obtain Achilles InSight Operation Certification. Please follow the examination instructions and apply for your certificate.